Hi everyone, the topic of this video is the 10 things that everyone should know about Lyme disease, and that I wished I had known when I first became sick. When I first became disabling sick with strange neurological and autonomic nervous system symptoms, never in a million years would I have thought that my symptoms had anything to do with Lyme disease. At the time, I knew as much about Lyme as most of the general public did, that it came from a special, smaller tick, known as a deer tick, which, of all the tick-covered dogs I had known in my childhood, and of all the ticks I myself had been bitten with, I had never seen. What I knew of the disease was that it caused a minor cold-like flu that produced a certain rash, and had promptly put it in the same category in my mind as measles, mumps, mono, and chickenpox. So lacking were any warnings about the disease, that I believed that if you got it, that you would get well, just like you did from measles, mumps, mono, and chickenpox, without any medical treatment. But I could not have been more wrong. Not only couldn't I have been more wrong, but what I did not know about Lyme disease, and what my doctors did not know, allowed it to progress to a point where it had a devastating impact on my life that I did not wish on anyone. So what are the 10 things you and your friends and loved ones should know, and that I wish I had known, about Lyme disease? You need to know that the majority of people with confirmed Lyme disease never saw the tick nor were even aware that they were ever bitten. You also should know that the majority of people infected with Lyme never develop the characteristic bullseye rash. It is also important to know that there are no special Lyme ticks, and all ticks are potential carriers of the Lyme bacteria. Ticks come in 3 sizes depending on what stage they are in their life cycle, and they are capable of infecting you with Lyme at every stage in their development. The standard-sized tick that most are familiar with can and does infect you with Lyme bacteria. And the half-sized tick that the media often shows is the same tick in its second life cycle stage. During the first life cycle stage, a tick is the size of a grain of sand, and although you are unlikely to feel it, it too can bite you and infect you with Lyme bacteria. When they bite you at this stage, they form a coating around their head and resemble a small scab. It is unlikely that you would realize that it was a tick, and you would likely conclude that it was just a small grain of dirt, or a tiny pinprick of a scab. It is very important to know that if it is caught in the first few weeks of infection, Lyme disease can be completely treatable with 4 to 6 weeks of antibiotics. However, once Lyme disseminates throughout the body, in other words, once it leaves the bloodstream and goes into other tissues, no method of treatment has ever demonstrated that it has successfully been able to completely kill off the Lyme bacteria. Disconcertingly, study after study has demonstrated that even after years of antibiotic treatment, live Lyme spirochetes are still extractable from the body. Therefore, it is imperative to treat any suspected Lyme infection as soon as possible. Not treating or delaying treatment for Lyme infection can have devastating consequences to a person's life. Many do not know this, but you should know that Lyme disease can lay dormant in you for many years before causing any noticeable problem. When Lyme disease attacks, it can mimic many other diseases, and it is often misdiagnosed as MS, lupus, any of the various forms of arthritis, CFS, ME, and fibromyalgia. The difference between Lyme and those other diseases is that there is a treatment for Lyme. Lyme disease can cause a variety of strange symptoms that you might not have been aware of. Some of the nondescript symptoms of disseminated Lyme disease are fatigue that can be extreme, muscle weakness, visual disturbances, abdominal pain, and GI tract issues. Symptoms of late-stage or disseminated Lyme disease also include pain, lots and lots of pain, including joint pain, neck and back pain, nerve pain, bone pain, muscle tightness and pain, a tightening of one's tendons, and even strange ribcage pain. One way to differentiate Lyme arthritis from other forms of arthritis is to know that arthritis typically attacks the smallest joints first and causes pain, redness, and swelling, whereas Lyme arthritis tends to attack the largest joints first, primarily the knees. And while it causes pain, it does not necessarily cause redness or swelling. Anyone with persistent unexplained knee pain should consider being tested for Lyme. Lyme disease can even cross the blood-brain barrier and attack your central nervous system. Some of the neurological symptoms of neuroborreliosis or neurological Lyme disease include brain fog and general confusion, issues with sensory overload, difficulty finding the right words, loss of balance and coordination, muscle twitching, electrical shock-like sensations, numbness and tingling, nerve pain and inflammation, and migraine headaches that can sometimes be quite severe. While you might not know it, late-stage Lyme disease can be, and often is, crippling. And then you need to know about the test for Lyme disease. Unfortunately, the standard Lyme screening tests that doctors routinely use to screen for Lyme, the ELSA and Western blot tests, are woefully unreliable. And unless you have looked into this, you would not be aware of how you should interpret the results. Studies have shown that there is only a 35% chance of a person with Lyme to have a positive test result on those standard tests. You should also know that a negative test result does not mean that you do not have Lyme, and this is according to the test makers, and the statistics decrease the longer you have had Lyme because these tests test for your immune system's antibodies to the Lyme bacteria. And as part of its survival mechanism, Lyme suppresses your immune system, meaning that you make less antibodies and thus your chances of positive result decrease. Lastly, you should know how to go about getting accurate testing. To get a more accurate test, if you suspect that you or a loved one may have Lyme, you and your doctor will have to special order the test from a company that specializes in Lyme testing. One such company is IGeneX. Although most insurances do cover the test, the laboratory does not take insurance. So you will have to pay for it upfront and then submit it to your insurance company for reimbursement. Insurances, through state or federal aid, will not reimburse you. If you cannot afford the Lyme testing, there is an organization that helps people to cover this testing, called Lyme Tap. Thanks for watching this video. Please feel free to pass it along to anyone you think might be interested. Also, feel free to like my page on Facebook, Zen and the Art of Lyme Disease. Bye for now.